not just in times of crisis, but throughout the year, 24/7, 365. So for our agenda today, we'd like to provide an overview of what 211 is. Many of you might be familiar with this resource, but we want to take just a few minutes to give a broad overview of what 211 is and how it's here to support our community and communities across the Commonwealth. We want to share with you a data tool that's publicly available. It's called 211 Counts. It's a way for anyone in our community and throughout Pennsylvania to access the data that we collect in 211 that helps us as communities understand what the needs are so we can work to support coordinated response efforts throughout the year. We want to dig into what some of the specific needs are that we've seen since COVID-19 has become a pandemic and our community has been responding. We also want to shed light on some of the organizations that have been a part of these coordinated response efforts. And then we'll leave plenty of time at the end for Q&A. So without further ado, what is 211? We think of 211 as the social service equivalent of 911. Folks know that when there's a fire, there's an emergency, you call 911. But what happens when you've got a family member that's struggling with addiction and you don't know who to call? What happens if you're having trouble paying your utility bills or rent? What happens if you need food assistance and you don't know where a local food pantry is? 211 is there to serve you and the rest of the community through free, confidential information and referral. It's fast, easy, and convenient. This isn't just a number you can call, and by and large, that's how folks are using 211. They're picking up the phone and they're calling and they're connecting directly with a live resource navigator to help explore their needs and provide information and referral. But you can also chat via an online function on the PA Northwest 211 website. You can text your needs to these resource navigators, and they'll follow up in responses to text message. And email is also an option. So we really want 211 to be accessible to everyone, and we do that through those various opportunities for connecting: phone, internet, chat, text, email. It's free and confidential. 211 is available in our community through United Way funding support. So the contributions that our local businesses and individuals provide to United Way in part go to funding 211 to make this available free of charge to every Erie County resident. It's confidential. The information that folks share with our resource navigators isn't shared with providers. It's simply used to help provide those callers with the referral information they need to find the resources that are best aligned with supporting their needs. It's professional assistance. This is a full-time professional operation with trained resource navigators who have the background not only to be compassionate with folks when they're calling, but to be very professional to make sure that the support that they're providing folks in these times of need or crisis is the highest of quality. 211, while available 24/7, 365, it's also essential in times of disasters and crisis. That's a big part of what we're going to be talking about here today. But a couple examples of how 211 has been leveraged very strategically in these times of crisis. If we think back a few years to the snow emergency in 2017, when we got feet upon feet of snow, 211 was there to very quickly work in partnership with Erie County and Team Rubicon to coordinate and deploy volunteers out to the homes of older adults or folks with disabilities to dig them out. This was certainly a crisis situation where folks were snowed in. They weren't able to get basic needs and resources that they needed. 211 was very quickly able to support the coordination efforts to make sure that those folks were safe and were available to receive the resources and assistance that they need. Right now, with COVID-19, early on, again in partnership with Erie County government, but this time around with Serve Erie, 211 has been an essential resource in terms of connecting volunteers to the organizations in place to respond to folks in need. So what we were seeing is that as the community was shutting down, organizations like shelters that were dependent upon volunteers, their pool of existing volunteers had become depleted. And so what we were able to do is use 211 to not only identify the organizations that needed volunteer support, but also allow interested individuals in the community who are healthy, who could volunteer, to call 211, and then Serve Erie has been making those connections to make sure that these response efforts are still fully staffed. And to date, we've had almost 200 volunteers connected through 211, providing these vital resources and services. So we talked about how 211 connects people in need. This is just a sampling of the types of resources and supports that we have in the 211 database. Currently, there's over 4,000 different programs and resources that are available through 211 in the Northwest region. We have a full-time database coordinator whose job it is to make sure that this database is as up-to-date as possible. Not only do agencies have the ability to, anytime, connect with the database and make changes when they have maybe a funding stream changes with their program, or a new resource becomes available, or something goes away. Agencies can make those changes directly, but we also have a resource navigator who's constantly on the lookout for changes that are happening in the community to make sure that when we make a referral, it's as accurate as possible. And so, again, this is just a sampling of the types of resources that folks are calling 211 about. 211 is not just available in Erie County and our Northwest region, but throughout the Commonwealth. And so no matter where you are in Pennsylvania, if you're traveling, when that's permitted, you would be able to call 211 and get connected to the call center servicing that region. So you would be able to find resources in that community if you or the folks that you're traveling with are in need. So we wanted to share this map so you can understand how comprehensive this network of 211 call centers really is. So to date, since we launched 211 in Northwest Pennsylvania in May of 2017, we've had over 23,000 contacts for folks requesting assistance, which really demonstrates how vital 211 is, not just in our community, but throughout the Commonwealth. So these are folks that are struggling. They don't know where else to turn. In the past, we have data that suggests that folks are making 5, 6, 7 different phone calls before they're able to actually get to the resource that they need. Now, there's that easy-to-remember phone number, 211, where you can call and you can get connected. So 211 counts. This is that new data tool that I referenced earlier. It's searchable data from 211 call centers across the nation. So just like we have a call center servicing our community, there are call centers throughout the state and throughout the country, and we all use a very similar database system. What this enables us to do is to centralize all of this information. We're not sharing, personally identifiable information at all. Everything is confidential, but we're able to use the notes from those calls to pull and pool data to make it available for communities for strategic decision making. We're able to display that specific need by zip code, by region, by call center. We can create custom reports. And the data here is updated daily. Every day at noon, the call center will dump information into 211 Counts database, and so it's readily available. And what we want to do right now is take you to that 211 Counts website so you can see it. I'm going to show you how you, at home or at work, can use this data tool to help inform your decision-making as well. So when you search for 211counts.org, you'll come to this landing page, and you'll see any of the states in green has the ability to search. You have the ability to search their 211 data. So I'm clicking on Pennsylvania. And here you'll see the landing page. So there's a lot here, but we're going to take a couple minutes and I'm going to walk you through what we have available to us.
Mike, you may
So the
need
first,
to close out of the PowerPoint and reshare your screen because we're still seeing the PowerPoint.
okay, Amanda, I'm going to do that. Can you see the website now?
Yep.
Okay, very good. Thank you for that note. I'll make it, I'll be sure to, anytime I share my screen, to stop and restart just to make sure that you all are able to see what I'm seeing here. So just to back up a bit, this is the main 211 Counts website where you can go, and any of these states in green you can click, and it will take you to the state-specific 211 Counts database website. There's a lot of information here, and I'm going to take a couple minutes and walk you all through how you, at work or at home, can use this tool to collect and to review some of the 211 data. So here's where you can sort by geographic area, and you'll see you have a lot of options. You can sort by zip code or multiple zip codes. You can check all the boxes that apply. You can search by county, and so if you see, we can go down to Erie and select that box. You can also search by congressional district or state house district, state senate district, school district, and then also region. And when we say region, these are those 211 call center regions that I mentioned earlier. I'm going to search by Erie County, and so I'm going to click search. The next filter item you'll see is the date range. And so you can search yesterday, the last 7 days, 30 days, the last year, or what is really helpful is this custom date range. And so what I'm going to do is search from March 16th to May 3rd. And so what this has done now is filter Erie County specific information by the date range that I've prescribed. And you'll see here, you can flip back between the percent or the actual number. So if I can call your attention down to the total top requests, this is the total number of requests since our community shut down on March 16th that have come through the 211 call center. Our calls, not just in Erie County, but throughout the state, have more than doubled since this time last year, which really demonstrates how much need exists in our community and how much folks are relying on 211 to find the resources that they need to be healthy and successful in life. It's broken the needs out into these categories. And within each category, if you click on it, it'll break it down even further. And I'm going to come back to this after we start talking about some of the priority needs. But you can basically go through each one of these and see a little bit more. I'm now going to flip back to our PowerPoint. Amanda, can you see the PowerPoint? Or are you still on the website?
Still on the website.
Okay, we'll try this again.
There we go.
Oh, now.
Yep, we're good.
Okay, very good. So in terms of the needs that we've seen coming from callers to 211, since March 16th to May 4th, this is the report that we ran, 20% of callers, so again, over 1,000 folks who've been reaching out in need of assistance, 20% of those folks have needed food assistance in various different forms. Close to 18% need help with housing and shelter. 17.6% with utility assistance. In the employment and income category, it was close to 10%, and for clothing and household items, it's 4.8%. So I'm going to take you to a report that we ran from 211. And depending on those search parameters that you selected when you're searching 211 counts, there's a link at the bottom where you can run and export that information into a PDF report. Either a detailed report like we have here, which is over 20 pages long per search query, or a brief report which just provides you the high-level overview. But here you'll see that for this report that we ran March 16th to May 3rd, just for Erie County, this is a percentage report. You can also run total number reports, so instead of percentage, like housing and shelter 17.8%, it would give you the number of actual callers. But for the purpose of this webinar, we're going to look at the percentages. Here you'll see that overview of the main priority areas and the number or the percentage of folks that were calling for those supports and resources. As you scroll down through the report, here's where it breaks out each one of those categories into more detail. So here we'll see that within the category of housing and shelter, for those 1,200 people who were calling, and for the 17.8% who were calling about housing and shelter, 25.8 were calling specifically about needing shelter, meaning they had nowhere else to go. I want to call your attention over here to where it says unmet need. So this is really important for us to understand and to have available to us, because what this means is that if someone calls 211 and there's not a resource in the database, or there's a resource in the database but it's temporarily unavailable, meaning perhaps it's a funding stream and that organization has run out of funding until the next phase of funding. That organization would contact 211 and say, hey, can you please remove this resource temporarily from the system because we don't have any more funds in that system. So it could be that. It could be that there's just not a resource in the 211 database, or it could mean that there's a resource in the database, it's funded, but for whatever reason, that caller doesn't qualify. You know, maybe it's specific to older adults, or maybe it's specific to folks with disabilities. So when we look at that unmet need number, that's information that our resource navigators are documenting to see, you know, if that resource was available for folks in 211. And you'll see when we look at rent assistance, with 50% of the folks who are calling about housing and shelter needing rent assistance, about 21% of those folks, you know, weren't able to get a referral. And so, you know, we like to talk about 211 as a resource for our community. What it is not is a guarantee of service. But we'll do our best to connect folks with the providers in our community that are able to help in your time of need and crisis. In terms of food assistance, the vast majority of folks were calling about food pantries. So, you know, there's so many out in our community, they don't know where to go. You can call 211 and we will direct you based on your location to the most appropriate resource. When we look at utilities, close to 50% of folks were calling about electric assistance, or gas, 25% around gas for gas assistance. When we get into healthcare, folks are calling about health insurance. Maybe they're underinsured or they don't have it, and so 211 is able to make those connections for them so they can get the resources that they need. Dental care, eye care, and you can see that that's an unmet need as well. Mental health and addiction. So a lower number of folks have been calling about this resource, but you can see for those that have, it's been a vital call because it's about crisis intervention and suicide. What's important to note about this type of referral is that in crisis situations, resource navigators at 211 are trained to do a warm handoff with crisis services. So if someone is calling and is suicidal or it is a crisis situation, the resource navigator will very quickly but calmly and professionally connect that person on a three-way call to crisis services so those professionals can manage that situation and support that individual who's been calling. Folks were also calling about just available mental health services. And this is one area where we've been making lots of daily updates in the 211 database because of how the services have changed, and especially with the transition to telemedicine. Employment and income, folks are looking for jobs. Questions about unemployment benefits or tax preparation service. Questions about financial assistance. Clothing and household items, about 5% of callers with this need. Looking for personal hygiene products, especially now in response to COVID-19, when stores are sold out. You know, what resources, what organizations out there are able to provide these supports to lower income folks that might need them. Childcare. So a lower number of folks calling about this, but you can see that many folks are calling about childcare. You know, what resources are existing now that our community has been shut down, but is slowly starting to reopen. So I'm going to switch back to our PowerPoint. Amanda, can you see the PowerPoint again?
Yep.
Okay, very good. So with that overview of the top requests and how you can use 211 counts to make custom searches and export that information, want to talk about some of the local response efforts. So I mentioned before that there's over 4,000 different programs and resources in the 211 database. This information we can't pull from 211 counts, but United Way is able to get this from our call center directly. We wanted to share with you the organizations that were getting the most referrals. So based on those needs, where are folks being connected? And here you'll see that GCAC has received 135 different referrals from those 1,200 folks who have been calling over the last couple weeks. GCAC provides a range of services in those priority areas, which is why they've been getting a number of those referrals. We saw how food assistance and food pantries specifically was a high need. Second Harvest is the coordinating organization for many of those pantries, and they have the locator to connect folks to the appropriate resources in that individual's neighborhood or community. And so a lot of referrals going to Second Harvest so they can connect folks to the appropriate pantry. When we talked about need for rent assistance, mortgage assistance, utility assistance, St. Martin Center provides programming to support in those areas. And so they've been getting referrals primarily around, at least from 211, for those supports. The Martin Luther King Center in the West Bayfront area, providing a range of services to the Lower West Side, a top referral source. Department of Human Services, who provides a range of support around emergency shelter. So we saw shelter as one of the priority needs, getting referrals. Dollar Energy Fund, this is the organization that the Pennsylvania Utility Commission contracts with to provide for electric and gas grant programs to help offset the burdens of folks who can't pay their utility bill. Salvation Army, there again with help for financial assistance, but also with meal delivery. And then Erie County Care Management, specific to 211, they're the organization that is a single point of entry for folks entering the homeless system. And so if someone needs an emergency shelter, and we saw that priority need in the data that we just looked at, you will call Erie County Care Management, and they will connect you to an available bed in one of our local homeless shelters. So we wanted to take a couple minutes to share with you some of the organizations that have been responding, and then based on some of that unmet need information that we saw in the report, here are some of the priority gaps that we've seen. And so, again, I mentioned this before, but this is how we determine unmet needs. For housing and shelter, that rent assistance. So, regarding rent assistance and some of these other areas, just as our community is working to respond to the needs in COVID-19, so is the state and the federal government, as we all know. But a relevant funding stream that will become available in the near future in our community that we wanted to put on everyone's radar is through the National Emergency Food and Shelter Program. So this is funding that Congress allocates to FEMA, and through a partnership with United Way Worldwide and local United Ways throughout the country, dollars are distributed out to organizations like the ones that we saw on that list, who are able to provide rent assistance, mortgage assistance, utility assistance. And so our hope in the next couple weeks is that there'll be increased resources available to our community and to communities throughout the country to help support with some of these gaps that we're seeing in the data right now. We talked about shelters and the need there. There are instances where all the existing shelter beds are full, but we know that county government, through the Department of Human Services, is working to make sure that there are emergency arrangements for folks. Help with buying food. So there are a range of of pantries out there that provide supplemental food, but that is at a certain frequency. So for folks that might need additional food in between when they're able to access emergency food, calling for help. But we can see that there's limited support out there for that. For feeding children, this is an interesting one because the school districts throughout Erie County, through the Department of Agriculture, are providing meals for pickup for any youth under age 18. The challenge is not everyone is able to access that food. If you're self-isolated or if you have transportation challenges, which many folks do, if you're working and your work schedule doesn't align with the time at which you're able to go and pick up the food for your children, that creates a gap or that creates a barrier. And so what we've seen and been a part of here in our local community are a range of different efforts to help get those meals into the hands of families. One initiative that is through United Way are the community schools, where we have community school directors and community school partners who are working really on a case-by-case basis to help make sure that families with young children are getting the food that they need by leveraging existing resources in our community, like that school meal program that I referenced, but also other resources as well. Another gap is home-delivered meals. So there are organizations like Meals on Wheels, also the Minority Community Investment Coalition, who are working to deliver meals out into the community. But what we're seeing is that the need is so high, not all folks are able to access that resource. And again, these are folks that might be homebound or seniors that are unable to drive, making sure that we are able to support folks in our local community. We talked about utilities. Also, a potential opportunity where our community will be able to better respond to some of those gaps. And then employment and income, just folks with basic financial assistance. And not everyone is able to get the resources that they need there. So again, really want to emphasize that 211 is simply here to connect folks to available resources. It's not a guarantee of service. But what 211 helps us do is identify what are some of these gaps. Where do we as a community need to focus or prioritize to help make sure that everyone in need is getting assistance that they need. So one of the questions that we talked about with Amanda in preparing for this is how can local businesses or individuals help? What can we do to support? The first is through volunteering. I mentioned that volunteer initiative earlier, where if an individual is healthy, if they're interested in helping with response efforts, they can call 211, provide their information, and Serve Erie will connect them to an organization that needs their help. In partnership with Erie County government, we're working to make sure that all CDC guidelines are followed, that we're trying to be as safe as possible throughout this process. But that's one way that folks can get involved right now. Also wanted to bring to folks' attention, if you're not familiar with it, United Way's Get Connected. This is while we've really strategically for this response effort used 211 to connect volunteers, Get Connected is there year-round. It's getconnectederie.org, where individuals who are interested in volunteering can go and search hundreds of different existing volunteer opportunities and connect directly with those organizations to help support our community. So we would encourage folks, as we return to, quote-unquote normal here in our community, that you continue that volunteer service and find organizations that speak to your talents and your interests, and you continue to volunteer. Similarly, for those organizations that might speak to you and that you are interested in supporting, reaching out to them to provide in-kind donations. Right now, we know there's a real high need for, as we saw in the data, for cleaning items, personal care items. And so reaching out to local nonprofits who are working to serve folks in this time of crisis, would you go out to the grocery store and you purchase the items that you need, maybe purchasing a little bit extra and donating it to the organizations that are there supporting folks. And then, of course, funding. As I mentioned early on, 211 would not be possible without the financial support from United Way. And so if you're interested and able, we would encourage you to go to our website and give to United Way to help support 211 and the range of other efforts that United Way is leading in our community to crush poverty, or, of course, to the organizations that are of interest to you. And so we encourage you, where possible, to get involved to support the needs that we've been seeing here in 211. And so with that, that concludes the presentation portion of this webinar, and we'd like to open it up for questions. And so, Amanda, I'll turn it back over to you. I know you posted in the chat feature if folks wanted to pose questions there, or if they want to raise their hand or just ask on the line, but I'll turn it over to you to navigate some of those questions.
Sure, thanks, Mike. It looks like we have a question that has come in as far as Get Connected. So this came from Erica Romalo at Gannon. We use Get Connected to connect volunteers and community needs. With the addition of volunteers to 211, how should we proceed?
So we would, again, and thank you, Erica, for that question. This is really a time-limited initiative through 211 for ongoing volunteer needs, continuing to use Get Connected, because that's the ongoing and consistent volunteer matching platform for our community. Probably in the not too distant future, we'll likely discontinue the volunteer matching portal through 211 as businesses start coming back and response efforts. So this was really, and I should have been maybe clear about that, really a time-limited initiative through 211. So for organizations that use Get Connected, please still do that. However, if there is something that's specific to a COVID-19 response, would encourage you to work with 211. And if there's any questions about that, and Erica, I'll reach out to you directly to talk through that. Encourage folks to reach out to me directly. My email is mike@unitedwayerie.org, and I can help navigate how to best use Get Connected in 211 for volunteers.
Great. Another question that I think, just to maybe clarify a little bit. So if someone's listening to this webinar and says, you know what, I really want to contribute either items or contribute financially to one of these organizations, what's the best way for them to do that? Should they go through United Way, or should they approach the organization directly? What would be your recommendation?
I mean, it's very easy for us to connect you directly or giving through United Way. So going to that link, or again, reaching out to us, mike@unitedwayerie.org. If folks already have an existing relationship with an organization, I mean, you're welcome to reach out to them directly, and I'm sure that they would be happy to talk with you about those opportunities. but we are as well. We're involved in a lot of these coordinated response efforts, so we can really work with you to help you understand what needs exist and allow the donor to really make informed decisions about how they would want to leverage their funding to support the needs. So welcome to reach out to us directly, but also, of course, encourage folks to reach out to the organizations that they might already be connected with.
Great. Okay, well, if there are no other questions, then I'll just reiterate that the replay of this session will be available. I'll be getting a follow-up email out probably sometime this afternoon. I'll also include Mike's email address and the slides from the presentation today. So if you have questions and you'd like to reach out to him directly, you're welcome to do that. And please feel free to share this presentation. I think it's become very obvious that there are a lot of people in need in our community right now. And so anything that we can do to provide support to those efforts and make sure that we're addressing the needs of those who are really struggling right now, I think that's really the purpose of why we held this webinar. So thank you to Mike and to the team at United Way for putting this together. And again, if you have any questions to Mike, you're welcome to reach out to him directly. I'll provide his contact information. So thank you again, everyone.
Thank you so much.